Okay, good evening, everybody. I was going to say good afternoon, but I think it's evening now. Welcome to my public lecture on sitting behaviour. Over the next kind of 40 minutes or so, I'll be kind of presenting some of the evidence on sitting or sedentary behaviour, as we call it. Normally when I'm talking about this kind of area of research, I always do a bit of a disclaimer at the beginning to say to people, if you feel the need to stand at any point during the presentation, then please feel free to stand, maybe move to the aisle so you're not blocking people's view behind you, but it's certainly not compulsory to sit throughout this talk. Don't worry, I will not be forcing anyone to stand. It's just a little disclaimer that as I go through some of the evidence that I'll be talking about later on sitting and health, you might feel the need to stand. So please feel free if you would like to. Okay, so probably most of you have seen some of these headlines like this. There's been a lot of media interest over the last kind of 5 years or so on sedentary behaviour or sitting behaviour. So again, the media have kind of picked up on research which has started to document links between sitting and health, and these types of headlines that you can see here have been quite common over the last few years or so. So again, the kind of slogan that we see quite a bit is sitting the new smoking, is our desk job killing us, etc. Quite kind of popular kind of media headlines that have been produced over the last few years or so. So what I really want to do today is I'm going to kind of be talking about some of the evidence that underlies these headlines. I'll be talking a bit about exactly maybe what is the scale of the problem, how much time are people sitting in general, do we need to be concerned about it, and then I'll be talking a bit about ways in which you can actually reduce or break up your sitting time if you are concerned about prolonged sitting. So that's really an overview of the talk. I'm going to try and keep to about 40 minutes or so, and then there'll be plenty of time for any questions, discussion afterwards. Okay, so I want to just begin by kind of introducing the topic. Sometimes we use the word sedentary behaviour or sitting quite often. These words can be used interchangeably. Sedentary behaviour in kind of our area of research has really been the term that has been coined to kind of describe periods of sitting. This is kind of the recommended definition for sedentary behaviour. So it really describes time spent sitting, lying, or reclining whilst awake and whilst expending low levels of energy. So of course sedentary behaviour is very different to sleep. Sleep of course is a different kind of health behaviour which isn't really linked to what I'll be talking about today. So what I'm going to be largely talking about is kind of time spent sitting or reclining or lying whilst awake. And the ever important kind of definition or part of this definition is that this behaviour pretty much takes place at rest. So again, it's associated with low levels of energy expenditure. Because sometimes people say to me, oh yeah, but what happens if I'm sitting and I'm pedalling on a bike? But that technically is not classed as sedentary behaviour because, of course, even though you might be sitting, you will still be kind of burning high levels of energy whilst pedalling. So sedentary behaviour is very much kind of waking hours, sitting behaviour, and expending low levels of energy. And of course it is kind of a very natural behaviour to us. It's something perhaps that most people do on a daily basis, and we perhaps don't even think about it too much. There is a statistic that I've heard people say that if you put a chair in the room, I think there's about a 5-second interval before someone sits in the chair. I think due to our kind of modern kind of lifestyle, our modern conveniences, we are very much accustomed to going into a room and sitting. So my kind of first question, this is maybe something for you guys to have a think about, is have you ever really thought about how much time you spend sitting on a typical day? Maybe just have a little think to yourselves about roughly on a typical day how much time you might spend sitting. And again, you have to think about obviously all your activities over the course of the day. Probably get up in the morning, having some breakfast, maybe kind of travelling to a place of work. Do you travel by motorised transport? What do you do kind of during work? or during kind of waking hours, and then what do you do in the evening. And if you kind of think about all those aspects of your daily lives, it kind of can help kind of guess or estimate roughly how much time you spend sitting. Is there anyone here that wishes to share how much time they think they spend sitting on a typical day? Don't be shy. 8 hours? Yeah, 8 hours sounds that's quite typical, yeah.
I'm actually retired now.
Okay.
Part of retirement is I've made sure I don't want to be so sedentary.
Mm-hmm.
When I was working in a desk job, 8 hours would have been certainly 7 to 8 hours
Yeah.
a day. Typical.
Right, yeah.
Whereas now it's probably more like 3 hours. That's mainly in the evening if I'm watching something on TV.
Yeah, okay. No, that's really good. That's really good. 11 hours, okay.
8 at work.
Okay, yeah.
Travelling and sitting.
Yeah.
Watching telly.
Yes. Yeah.
It's very bad.
Yeah, it's quite scary how it adds up. When you think about if you've got a desk job, if you're sitting a lot at work, then that's a huge chunk of time. And then certainly to travel to and fro work, if you're commuting, that's a lot of time. And then in the evenings, particularly now this time of year when it's a bit colder, the evenings are dark. It's not really conducive to perhaps going out as much. So it can be quite kind of surprising when you think about it in total. Anyone else got anything they want to add, or does that range sound pretty reflective to most people? Okay. Don't worry, in a minute I'm going to show you some data that I've collected on me, so I'll be kind of coming clean and showing you some of my sitting time data back in the old days. Okay, so just to kind of, again, put it into context, this is just some data that we've collected from working-aged adults participants wore a gadget on their waist, which picked up their movement over the course of a week. So this kind of gives us an estimate of roughly how much time they're spending sedentary, which is shown in red here in the pie chart. And you can see that for these kind of working-aged adults, time spent sedentary pretty much made up about 2/3 of their waking hours. In this particular sample, this equated to about 9.5 hours per day, and of course these are all mainly desk workers, so this included time at work and time outside of work. These individuals were then spending about kind of just over 30%, or about 4.5 hours in light activities. So these are activities really associated with kind of daily living, so pottering around, just kind of walking slowly from place to place. And then the rest of their time, about 5% of their time, was spent in moderate to vigorous intensity activity. So this is types of activity which could be associated with brisk walking, jogging, running, kind of more faster cycling. So these moderate to vigorous activities are anything really that increases your body temperature slightly, increases your rate of breathing. And it's that part of the pie, this kind of green bit here, this is what traditionally the government has recommended to us that we should do a sufficient amount of to get health benefits. This particular sample, even though it looks like they're spending a small amount of time in these moderate to vigorous activities, about 5%, this particular sample relatively active, so they were doing 42 minutes on average a day of moderate to vigorous activities. The government guidelines at the moment suggest that we should be doing about 150 minutes per week of moderate to vigorous activity. So these individuals are kind of meeting the government guidelines for activity. But what's perhaps surprising by this slide is even though these people are physically active, they're still spending a large proportion of their time sedentary. Maybe more concerning is some data in children. So this is, again, some accelerometer data from children. This is a sample of UK children aged 9 to 10 years. The measurement of their behaviour is the same as what we did in our adult study. And again, in these children, you can see that almost 2/3 of their waking hours are spent sedentary. Obviously, they're not spending as long in sedentary behaviour as adults, but that's normally because these children obviously don't have such long waking hours as adults. But these children are still spending about 7.5 hours per day sedentary, which again is quite concerning. So the data I've showed you over the last two slides, these are data again from kind of UK samples, but they're quite reflective of other data from other countries such as kind of the US, Canada and Australia. So there's a general kind of consensus that most kind of most adults, working adults, and most children typically spend about 2/3 of their day sedentary. Okay, so kind of the next kind of thought really is kind of what are kind of the factors which are responsible for these kind of relatively high levels of sedentary behaviour. We've spoken a bit already about kind of the workplace, that most people nowadays, and as we'll see shortly, are employed in kind of desk-based jobs. So most people kind of sit down a lot as part of their day. We've also mentioned about commuting as well. Again, lots of people sit a lot in transport. Can anyone think of any other factors that might have led to us being quite sedentary nowadays? Computers?
I was going to say, information technology entices people to a set working place for
Yes.
sitting in front of a VD for hours on end.
Yes. Yeah, definitely. Computers are a massive issue nowadays. Again, it's really since kind of the advent of computers that now workplaces have changed quite dramatically. Also, actually, this is an aside, but what is really scary, when I actually do a similar lecture to our undergraduate students, and I kind of ask them, the same question, no one mentions computers now, because of course they don't know life without computers, whereas some of us do. So that makes me feel quite old when I talk to them. Anyway, kind of that's an aside. So certainly the computer is a big issue, and really modern conveniences of everyday lives. So again, these are just some kind of pictures that I put together, which I think perhaps sums up pretty much a lot of factors that have impacted our overall kind of activity or inactivity levels throughout the day. So again, sitting at work, certainly sitting in leisure time as well. Most people in the evenings will sit and watch TV, or nowadays actually use their phone, kind of their tablets, etc. Again, a lot of people actually do travel quite a lot to get to places now due to kind of changes in kind of environments. We're seeing more and more houses being built or estates being built on the outskirts of towns. So people are typically relying on motorised transport a lot more to get from place to place. The picture in the middle here, the ATM, this is actually a drive-through ATM. Luckily I haven't seen them in this country. I don't know if anyone has, but they are quite popular in America. So in America, a bit like you kind of drive through McDonald's, your Burger King, whatever, you can actually drive through and get your money out the wall. Again, things kind of like modern conveniences about kind of getting our shopping delivered, all these subtle changes. Again, yes, they're brilliant for making our lives nice and convenient, but again, it's overall reducing the amount of activity that we do as part of our daily living. And also, again, in the home environment, we're getting lots of kind of more technology all the time to help us with our household chores. So again, nowadays you can get these remote kind of hoovers that kind of go around and do the hoovering for you, which actually for me with two Labradors that's quite tempting, but I can't bring myself to get one of those. And again, mentioned already about the workplace. Again, the workplace is a huge driver for kind of bringing about changes in our overall sedentary behaviour. I'm just going to show you now an office. This was actually my office a number of years ago before we moved buildings, and I just wanted to point out a few things to you. This is probably now about 10 years ago, and this office was pretty typical of colleagues' offices at the time. So just to point out a few things, in my office I had, obviously, my regular computer, black and white printer, and then here I had kind of this nice colour printer, which also doubled up as a scanner, a fax machine and a photocopier. And just out of shot here, I had a little mini fridge and a kettle. So you're kind of seeing hopefully where I'm going with this. I made my office really kind of comfortable. I had all the conveniences in this office. So on days when I wasn't teaching, and if I didn't have any meetings, I could quite happily spend an awful lot of time in this office, not doing kind of much movement. And again, this was typical of other colleagues' offices at the time. So one day I actually wore an accelerometer, again this little gadget on my waist, to actually look at my kind of overall activity levels on a typical day in the office. I think at the time I was just preparing some teaching material on measuring physical activity, so I thought I'm going to measure my activity so I can show the students some actual data. But this was quite an eye-opener for me. So this is just my kind of acceleration data, my movement data from about 8:30 in the morning. So you can see just getting to work here, not much movement at all throughout the morning, a bit of movement around lunchtime, a bit of movement in the afternoon but not much. Then in the evening, on that particular day, I did an aerobics class that I used to do here on campus, and you can see from that I actually got a lot more kind of physical activity, proper kind of physical activity. So anything above this red line here is classified as moderate to vigorous intensity activity. And again, this is the type of activity that the government are recommending that we do for health benefit. So when I kind of looked at my data, when I analysed my data, I found that on this typical day I was spending about an hour and a quarter in kind of light activities. So this is everything below this line here, again probably pottering around, just walking slowly around the department. Did about 24 minutes of kind of moderate activity, so that's anything in this area, and 14 minutes of vigorous, really all thanks to the aerobics class at the end of the day. But I was actually quite horrified when I looked at the data and I saw that on that typical day I was actually sedentary for 10 hours and 47 minutes. And this was actually quite an eye-opener to me. And I used to think that, okay, I know I sit a lot as part of my job, but I am relatively active in my leisure time. I typically meet guidelines through kind of these types of classes, so I should be fine. And that was my kind of mentality for a few years. And then, of course, the evidence started to come out, which started talking about links between sitting and poor health. And then some evidence started to suggest that actually, even if you are physically active, you may still be at risk. And I'll talk through some of that evidence in just a minute. But that really made me kind of start to think about my overall kind of behaviour, and it brought about quite a few changes to my kind of daily routine. Again, just to kind of summarise some other data that we've collected, maybe just to make myself feel a bit better, that I wasn't the only office worker that kind of sits for about 10 hours a day. This is a survey of office workers in Northern Ireland that we conducted a few years ago. So we've got data from just over 4,000 office workers here. And on a typical work day, these individuals are spending on average just over 10 hours per day sitting, with about 60% of sitting time coming from sitting at work. So the workplace, again, is a huge contributor to daily sitting. These individuals are spending about kind of 7.5 hours per day sitting on a non-work day. What we found as well from this study, which again was perhaps slightly worrying, is that people who sat the most at work also then were more likely to sit the most at home. So again, sometimes people might try and compensate by sitting less at home, but we found actually the general trend was if people sat more at work, then they sat more out of work as well. And again, this is just some really summary data from other occupational groups. So I've mentioned quite a lot already about office workers, but we've done some measurements of people working in other industries, people working in kind of the retail industry, so in kind of clothing outlets, that they're doing pretty good. They're on average sitting for about 6 hours a day, and this is total daily sitting, so it includes sitting at work and sitting at home. Office workers, again, typically across a number of studies, typically sit for about 10 hours a day. We've also been doing some work in bus drivers and lorry drivers. These are people that I kind of call compulsory sitters because, of course, they have to sit, obviously, whilst driving. They don't have a choice. These individuals typically sit between 12 and 12.5 hours a day, and call centre workers as well, another group with very high sitting times. So I want to just kind of move on now and kind of talk about some of the evidence that links sitting to health. And at the end of this section, I'll give you my view on this question: is sitting the new smoking? So first of all, just a bit of kind of history into the topic. So some of the really early evidence on links between what we say now perhaps sitting and health was perhaps first actually published back in the 1950s. This work originally didn't really claim to look at sitting and health. This work was very much looking at kind of occupational physical activity and health. But some of us perhaps now say, well, actually, maybe it's the first evidence that links sitting to health. So this was some research that was conducted, as I said, back in the 1950s, looking at London bus drivers and bus conductors. So that was back in the day when there were still bus conductors. And of course, these individuals were a really interesting group to compare to the drivers, because of course the conductors spent a large part of their day obviously on their feet, going up between the decks of the bus collecting money, whereas the drivers obviously were sitting a lot driving. So what Jeremy Morris and his colleagues did in a series of studies, they looked at kind of the health outcomes between the drivers and the conductors. And typically they found, if they looked at the rates of heart attacks or risk of heart disease, they found that the drivers had a much higher risk of suffering from a heart attack or heart disease, or even early death caused by heart disease than the conductors. And again, this was all at the time put down to the fact that the conductors were a lot more physically active whilst at work. But perhaps it was also due to the fact that maybe the drivers were sitting a lot as well as part of their daily job. So the evidence has been kind of increasing a lot over the last kind of 5-10 years or so, and over kind of the last 3 or 4 years there's been a number of kind of reviews that have been published which have really grouped together the evidence to date to look at links between sitting and poor health. So this is one of the most recent reviews, and this kind of grouped together data from 47 other studies that looked at links between sitting and poor health. And in this particular study, what they did was they compared people with the lowest sitting times to people with the highest sitting times. And these individuals typically in these original studies were followed up over a number of years, and the authors would then have access to medical records, so they'd be able to look for either the occurrence of heart attacks, diagnoses of different diseases such as diabetes, etc., and mortality rates. So some of the key findings from kind of this particular study were that people who sat the most in comparison to people who sat the least had about a 91% increased chance of, or increased risk of developing type 2 diabetes, about a 17% increased risk of cancer mortality, an 18% increased risk of cardiovascular disease mortality, and about a 24% increased risk of all-cause mortality. And in these analyses, the researchers try to kind of control for physical activity. So they say as far as possible, these findings are perhaps independent of physical activity. And again, these are the findings that kind of made me kind of think more about my kind of overall sitting time throughout the day, in addition to activity levels. I just want to mention another study which was published in the Lancet, so again one of our top medical journals, 2 years ago now, and again this was a similar kind of review. This paper actually grouped together lots of evidence from earlier studies and kind of looked at links between sitting and premature mortality from all causes. And what this group of authors did was they actually grouped people into 4 groups based on how active people were, because they really wanted to see, does physical activity protect against the harmful effects of sitting, or is sitting completely independent? So what I've tried to do in kind of this graph here is kind of put some colour coding in place. So the people on the far right with kind of the red kind of coding, these individuals are quite inactive people, so typically they're spending just about 5 minutes per day in kind of meaningful physical activity. And then what we can see here at the bottom is time spent sitting in these individuals. So less than 4 hours a day, 4 to 6 hours per day, 6 to 8 hours per day, and over 8 hours per day. And everyone in this graph is being compared to this kind of group of people over on the far left. So this particular group of people, these are the most active individuals. These individuals are typically doing between 60 and 75 minutes per day of moderate to vigorous activity. So here, kind of the comparison group are the most active group and the people who sit for less than 4 hours a day. So mortality rates in all these other groups are compared to this group here. So this is definitely kind of the worst kind of group to be in. People at the extreme case here who really don't do much physical activity and who sit for over 8 hours a day have about a 70% increased risk of early mortality in comparison to people who are very active and who sit for less than 4 hours a day. So what we kind of see in this graph is what we call like this dose response kind of measure. So the more sitting people do, the increased risk they have. But also this graph kind of does illustrate that physical activity is obviously really important for health because, of course, people in the most active group here have a much lower risk of premature mortality. So this group here, they're quite an extreme group for kind of physical activity levels. So these individuals, as I said, are doing about 60 to 75 minutes every single day of kind of at least moderate to vigorous activity. This is probably equivalent, if you're a runner, of kind of running about 6 miles a day, depending on your pace. And again, not kind of many people in the general population actually meet kind of this level of activity, and it's certainly a lot more than what the government recommend. But what the authors from this paper kind of suggested was that if you do that amount of physical activity, then you are protected against high volumes of sitting. So even if you sit for over 8 hours a day and you do that amount of activity, you're protected. But of course the problem is most people in this country don't do anywhere near this amount of activity. So again, most people are probably in this area or this area here. So again, the more activity you do, kind of the less risk you have from long periods of sitting. But it does seem that we should be kind of promoting both behaviours. We should be promoting reductions in sitting, but also increases in physical activity. So the argument about if sitting is completely independent, that's very much questionable. I think the behaviours are kind of interlinked. But there's still lots of debate going on in this area at the moment, and there's still obviously lots of research that needs to be done to really kind of tease out exactly what kind of risks prolonged sitting kind of gives you, and if you're active, how much are you protected. So with that in mind, I keep getting asked quite a bit, so how much sitting time is acceptable? Is there kind of amount that I can go up to and I shouldn't exceed kind of that amount of sitting time? At the moment, we can't really answer this question. We're still obviously waiting for research evidence to kind of give us an answer to this question. So this is very much, I say, the $1 million question at the moment. So unfortunately, we don't quite have an answer to how much sitting is acceptable. Again, studies are starting to come out to actually look at kind of time periods. So again, this is a very recent study, another review paper which was published earlier this year, and kind of the key kind of finding from this paper was they found that for kind of premature mortality and cardiovascular disease mortality, risk is increased in people who sit for more than 6 to 8 hours a day. So again, they're kind of talking about this is a potential threshold. TV viewing time does come out as quite an unhealthy behaviour in these studies. So again, this study reported that if people watch TV for kind of 3 to 4 hours per day, then this can also dramatically increase risk. But when we think about TV viewing time, we also perhaps have to think about other behaviours that accompany TV viewing. So it's quite common, maybe, particularly cold, dark evenings, you might sit and watch TV and have some unhealthy snacks kind of whilst you're watching the TV. So certainly TV viewing can be confounded by other behaviours. But really at the moment, we don't have kind of a definitive answer on how much sitting is too much. We're still waiting, obviously, on a lot more evidence to come out. What I can tell you, however, is it's perhaps not just how much you sit that seems to be important. It's also how you accumulate your sitting time. So there's lots of evidence which is coming out now which does suggest that if you regularly break up your sitting time, then that actually has some favourable health consequences. So people who regularly break up their sitting seem to have better health profiles in comparison to people who sit for long periods of time. And the laboratory evidence is also coming out which really supports that. So studies in the laboratories have shown that if you get people to sit in a lab for, say, 5 hours after you fed them a standardised meal, and then if you compare that to another condition where they sit for, say, 5 hours after the same meal, but every 20 minutes or every 30 minutes, they break up their activity with, say, 2 minutes of light walking or faster paced walking, then that seems to have a better effect on particularly blood glucose control, which again can help mitigate diabetes risks. So there's a lot of evidence coming out from lab studies which is kind of suggesting that actually regularly breaking up your sitting is beneficial. But again, at the moment we don't have strong enough evidence to say that you should break up your sitting every 20 minutes, every 30 minutes, for example. Again, we don't have kind of the volume of evidence on that just yet. But again, overall kind of certainly review level evidence has suggested that regularly breaking up sitting seems to be beneficial for health, and it seems to have the most benefit in people who are perhaps at risk. So individuals who are overweight, obese, people with type 2 diabetes or at risk of type 2 diabetes seem to get the biggest benefits from breaking up sitting. Some people can get benefits just through standing. Other people actually might need to engage in kind of more activity, so light walking, moderately paced walking to get the benefits. So again, based on kind of the evidence that's been collected over the years, sedentary behaviour was actually mentioned in the government physical activity guidelines for the first time in 2011. So when the guidelines were reviewed in 2011, they had this additional component that all adults should minimise the amount of time they spend sitting for extended periods. This is quite a vague kind of recommendation because really at the time, again, there was even less evidence to what we've got now. But it was quite exciting to see that sedentary behaviour had been kind of mentioned in the guidelines. Currently at the moment, these guidelines, the 2011 guidelines, are being reviewed. So not just the sedentary behaviour guidelines, but the guidelines for physical activity as well. So there's a big review process going on where all the latest evidence is being kind of really scrutinised to see if these guidelines, particularly for sedentary behaviour, can be more specific. So just a bit of kind of an insight on at the moment where we are with this review process. This is kind of some potential text or similar to some potential text which might be launched later on for the guidelines. So again, it's felt at the moment that we still don't have strong enough evidence to actually put a time value on how much sitting is too much or what's the minimum amount of sitting you can do, and we still don't really have enough evidence from lab studies to say you should break up your sitting every 20 minutes or every 30 minutes. So the guidelines, it looks like they're still going to be quite vague. Okay, so just kind of to draw this section to a close, to kind of answer the question, is sitting really the new smoking? Again, there's been lots of debate in the literature on kind of this question. I think most people are really saying that perhaps no, sitting isn't really the next smoking, because if we compare kind of risk for kind of premature mortality and different diseases between these two behaviours, sitting really perhaps doesn't come close to the harmful effects of smoking. So again, just from some of the evidence which suggests that people who sit a lot have about a 24% increased risk of premature mortality. That's compared to about 180% increased risk in smokers. Obviously the smoking data can vary depending on literally how much people smoke, so these are just some kind of indicative percentages. So at the moment, kind of the evidence really does suggest that perhaps don't believe all the headlines you see in the newspaper about sitting being the new smoking. Certainly it's definitely not as harmful as smoking. And also, of course, with smoking you've got other factors such as the addiction side of things, and the fact it can harm other people through secondhand smoke. Okay, so I've kind of started by talking about kind of how much time people sit for, and now hopefully I've given you some of the evidence that does suggest that prolonged sitting can be detrimental to health. So I just want to kind of move on now and talk briefly about how to reduce daily sitting. So again, there's obviously different kind of contexts, different ways in which we can reduce sitting. So first of all, I just want to mention some strategies that people can adopt, perhaps first of all in the workplace, to reduce sitting. So it's been recommended that perhaps people should try, if they use a computer, they should try and kind of have a break from their computer, like every 30 minutes or so, or every 20, every 30 minutes, just kind of stand up, maybe even just turn away from the computer, or take a very short walk. Again, if you're in an office area with stairs, always try and use the stairs as opposed to kind of using the lift. Another really simple strategy is if you're on the phone, stand for phone calls. If possible, depending on where you work, you might even be able to stand and walk around for phone calls, but certainly standing on the phone could be quite a good simple behaviour change technique. Again, if you've got a bin in your office, maybe move the bin out of your office, maybe use pooled bins, so again it forces you to go and kind of walk to dispose of any rubbish. Again, use pooled printers, remove the printer from the office. I think most workplaces nowadays are actually kind of implementing these types of practices. Certainly in our new building, we're not allowed our own printers in the offices. We have to use pooled printers. We have no bins in our office. We have to use kind of shared bins. So again, these kind of subtle changes can really perhaps make quite a difference. Again, a real kind of classic recommendation is always kind of go and actually see colleagues as opposed to emailing colleagues. Again, a number of people perhaps are quite guilty of like emailing their colleague who's in the office next door, or even sat kind of in the cubicle next door, to ask them a question where rather they could easily go and speak to them. Drink more water. Again, this kind of has a twofold impact really. If you drink more water, obviously you have to get up more to go to like the water cooler or the tap to get the water. It also means that you have to go probably to the loo more often, so you kind of get two ways in which drinking more water can actually increase your activity and your movement at work. Again, when perhaps arriving at the workplace, park further away. This also applies to any place really. If you're going shopping, going kind of anywhere in kind of leisure time as well, just park further away so you get more of a walk. If possible, a suggestion is to use a height adjustable desk. Again, I've seen all different sorts of solutions to height adjustable desks. You can get full-on desks that move up and down. You can get add-ons to your existing desk, or you could even get a box that maybe contains or is an empty box from paper from the photocopier, and actually put that on your desk and create your own kind of adjustable desk. Another recommendation is just to kind of eat lunch away from kind of your desk. So again, it forces you to kind of leave the desk area for lunch. Stand at the back of the room for presentations, kind of meetings, just so you get some opportunities to stand, and also perhaps have a standing or a walking meeting, which seem to be increasing in popularity. So again, a number of strategies that you can adopt to kind of reduce your sitting at work. Again, this at the moment is very much tailored towards office workers. I will go on and mention other workers in a couple of slides' time. Just to kind of follow on from that about reducing sitting at home, again, perhaps not so many strategies for reducing sitting at home, but again, perhaps just say to yourself every kind of 30 minutes or so, I'm just going to stand up, have a stretch, kind of move around. Sitting, kind of watch TV, and if it goes to an ad break, rather than maybe fast forwarding ad breaks, if you've got kind of your show like on demand, or if it's a recording, then perhaps just use the ad breaks as an opportunity to stand and move around. And again, kind of if you're kind of using your phone to kind of check emails, texts, calls, etc., then again stand or move around the house whilst kind of checking your phone. And again, at home, just drink more water. So those are just some solutions or some suggestions for people kind of more in desk-based work. A lot of our work at the moment is also focusing on people who drive for a living, who again I term compulsory sedentary workers. So again, lots of solutions, as we've seen, exist for office workers. Particularly sit-stand desks are really increasing in popularity in the workplace nowadays. But what happens if you cannot get up and move during your day? So if you are a driver, for instance, you've actually got no choice. You have to be sat in your vehicle driving. We've been doing quite a lot of work with lorry drivers, so long distance, heavy goods vehicle drivers over the last few years. And again, we found quite kind of worryingly that these individuals have quite high risk factors for poor health. They tend to be kind of more of an ageing, at-risk workforce, and they have of concern kind of some of the lowest life expectancies within this country in comparison to other occupational groups. And if you think about perhaps the job environment of a long-distance driver, obviously they're forced to sit a lot as part of their job. Perhaps when they get to kind of rest stops, service stations, these places don't necessarily offer the healthiest of food choices, so their kind of food choice environment is kind of very limited. So again, there's a whole host of factors that can kind of impact the health of this working population. We've actually created what we call a structured health intervention for truckers, or the SHIFT study, and this is kind of an intervention that we've created really in partnership with lorry drivers over the years, and we've put together this kind of multi-component intervention to try and increase kind of health behaviours in this group. So this programme includes, first of all, detailed health assessment. The drivers meet with a trained member of staff for about 2 hours and have quite a thorough health assessment. So we look at kind of blood levels of cholesterol, sugar, we look at their body composition, their blood pressure. We collect lots of questionnaire data from them as well to look at levels of, for example, stress, anxiety. If our drivers are then in the intervention arm of our current study, they then attend a 6-hour education session, and this is very much a group-based education session. It's an interactive session, and this education session has really been derived from a programme which is used throughout the NHS for diabetes prevention, but it's been tailored for lorry drivers. And this session very much focuses on physical activity and on diet as well. So we help the drivers actually come up with solutions on their own on how they can get more activity into their daily lives and how they can improve their diet. As part of our kind of intervention package, we're giving our drivers as well a Fitbit, so they can use the Fitbit to track their steps and also undertake with their colleagues some step count challenges. And we've also created what we call the cab workout. This is where we give our drivers resistance bands, balls, grip strength devices, and we've actually created a little resistance workout that they can actually do in their cab, which we teach them in the education session, and they go away with a little booklet which describes all of the activities. We do stress to them that it should be done whilst not driving, so in the passenger seat at rest stops, and it's really designed for periods if they can't leave their vehicle. So a lot of drivers have told us in the past that they may drive for a few hours, they get to a depot, and due to unloading happening around them, they can't actually leave the cab. So this cab workout is designed for that time period. They have kind of health coach support throughout our 6-month intervention, and then we do follow-up health assessments. So we're currently evaluating this programme at the moment with DHL. We're going to be working across 25 DHL sites with their long distance drivers. We will be recruiting about 336 drivers into the study. So this is very much an ongoing project at the moment, and this is really just a summary of kind of how the project works. So we do the health assessments, and then we randomise the depots into an intervention or control depot. The control depot, the drivers benefit from getting the detailed health assessment, but then they don't get anything else. They come back to us and get another health assessment in 6 months and 12 months and then the intervention depots undergo the education session, get the Fitbit, get the CAB workout equipment, etc. So this is just a study that we're doing at the moment in this kind of more hard to reach kind of population to try and hopefully improve their health. We're kind of running kind of short on time, so I'm just going to mention really briefly a bit about sedentary behaviour in children, but this again is just to kind of summarise sedentary behaviour research in children that we're doing. So again, in children there is some evidence that sedentary behaviour or sitting is kind of a risk factor for poor health, but the evidence in children really isn't as strong as what it is in adults. So again, it's quite debatable at the moment on kind of how much sitting is a risk factor in children. But what has been shown in the literature is that behaviours such as kind of sitting and physical activity, these behaviours can track throughout childhood into adolescence and adulthood. So children who sit a lot are more likely to become adults who sit a lot. And because there is stronger evidence in adults that sitting is bad for health, then we feel that it is perhaps important to target sedentary behaviour reductions in children. And one of our goals from work we do in children is really to target hopefully the next generation of the workforce and get children kind of into the mindset of perhaps reducing or breaking up their sitting time. So hopefully as they grow up they'll become accustomed to perhaps sitting less. We've been doing some work in Bradford, and because we've actually found from some early work in Bradford that because it's quite a deprived location, children in Bradford schools, or in Bradford in general, seem to be quite sedentary. So some of our early work has shown quite worryingly that some Bradford school children typically spend about 10 hours a day sitting on school days and then about 11 hours per day sitting on weekend days. So again, this group of this particular population seems to be the population where we might need to target some behaviour change interventions. So we've been doing a programme of work where we've actually introduced some adjustable desks, so sit-stand desks specifically made for children in the classroom environment, and that's just an example of kind of one of the desks that we've been using. So we've recently just completed a study looking at kind of the feasibility of introducing these desks into classrooms. Overall we found that they seem to be quite effective. The teachers actually like them, the children like them, and the teachers interestingly reported that they actually found that the desks improved the children's behaviour whilst they were in class. So again, the desks were received very favourably from certainly teachers, senior teachers and parents. Again, some of this work kind of attracted quite a lot of media interest when we first started it, because I think this study was one of the first in this country to actually introduce sit-stand desks into the school environment. So again, this is another kind of area of work that we're really pursuing at the moment. Okay, so that really draws kind of this talk to a close. So again, just some kind of final take-home messages and perhaps linked to kind of the questions at the start. So are we spending too much time sitting, and is this a cause for concern? I would say that perhaps we probably are spending too much time sitting on the whole, with kind of most adults spending about 2/3 of their waking time sitting. This is quite a lot of time. And again, there's emerging evidence all the time that does suggest that long periods of sitting seem to be kind of detrimental to health. But of course, physical activity, again, is really important. So again, I think we need to kind of give off two messages. We need to get people to be more physically active, and we need to get people to sit less. So overall, kind of my main kind of motto, my main take-home message is where people are physically able to, people should try and kind of reduce their sitting as much as possible, and just kind of sit less and move more. And that really draws it to a conclusion. So I say thank you very much for listening, and I'll be happy to take any questions.